Cholesterol testing is a full test to look at trends and see what's going on. If you're trying to look at, a lot of times people depend on stress tests because what happens is they go to their doctor's office and their doctor says, oh, your cholesterol is getting higher, and they will, they might mention that, you've got to take a statin or a cholesterol lowering drug to lower cholesterol. Now, cholesterol comes in different sizes. And at the HeartFit Clinic, we want to understand particle sizes, and that becomes more important. And there are a bunch of atherogenic, I'm using a big word here, but there are a bunch of atherogenic or plaque-causing particles that can sliver into the lining of the artery wall. So inside the lining of the artery wall is all skin. It's just like the skin outside of our body. Number one, first thing that has to happen is inflammation. So something has to cut that lining of skin. Once it does get cut, this is why the majority of people who have heart attacks and strokes have normal cholesterol profiles, is because they've got some cuts to the artery wall, and those small particles, I talk about them as golf balls and tennis balls. Tennis balls, imagine the artery is protected by a tennis net-like structure. Tennis balls don't go through that tennis net, golf balls do. And so what we're looking for is those particle sizes, those golf balls that can sliver into the lining of the artery wall. And now there are other atherogenic or plaque-causing particles that are important to understand that can sliver into the lining of the artery wall and start to build up like a pimple on our face. And this is what we do at the HeartFit Clinic. We want to find out a little bit more advanced testing than just going to your family doctor and getting cholesterol testing. I think that's a good starting point. It's a very good starting point. But if you're looking for a better test to understand and more advanced testing to see what's going on with cholesterol, this is what we do at the HeartFit Clinic.